Welcome back to HEALTHline. I'm just going to dive into the true and false questions that I'm asking our awesome urologist, Dr. Kamyar Ebrahimi from Glendale Adventist Medical Center. Doctor, are you ready?
Go ahead.
Number 3. Tests can help determine if you are at risk for prostate cancer. True or false?
I mean, PSA is a good screening
Perfect, because it's exactly what we're talking about.
That's what it is. But, you know, that test does not tell you if you have prostate cancer or not. It just tells you if it's elevated, what's the likelihood of you having prostate
Then, Doctor,
cancer.
what is the specific test that tells a patient?
Prostate biopsy.
Pardon?
A prostate biopsy.
And what is that?
Basically, it's taking samples of the prostate, getting it examined by a pathologist, and see if it's cancerous or not.
Okay. Number 4, some drugs can slow the progression of advanced prostate cancer down. True or false?
True. Hormone therapies, which is decreasing the amount of testosterone in the body, can definitely decrease the progression of advanced or any kind of prostate cancer. Absolutely.
And the last question, so far so good, 4 out of 5, doctor. Most men with prostate cancer will eventually die of this disease, true or not?
That's not true necessarily. However, that comes back to we cannot predict who will die of prostate cancer if they're diagnosed with prostate cancer. We can tell you if someone's older, they have a less likelihood of dying with prostate cancer, because most likely they have other comorbidities such as high blood pressure, heart disease, lung disease, kidney disease that's going to get them, so to speak, before the prostate cancer is. That line is blurry. It used to be 65 10 years ago. Now it's probably 70 to 75.
Do you feel we're getting healthier, doctor?
I think we're getting to live longer because of advances in medicine.
Great.
So someone's heart disease is being better managed with medications or interventions. So patients are going to live longer, whereas they would have died 20, 30 years ago because of a heart attack that we couldn't have done anything for. So are we living healthier? I think that's a societal question.
But it's a bigger conversation.
It's a bigger conversation.
And also men are more reticent to not go to the doctor.
Correct.
We're talking about our health a little
Correct.
bit more, wanting to get a little healthier.
Right, and because let's just keep it generalized and say, what else should we do as men to keep us healthy? Well, prostate cancer is just the tip of the iceberg. The other things that men should think about is colonoscopies after the age of 50 once a year, taking care of their
mandatory
heart, exercise, diet,
stress,
and stress reduction. You know, these are things that are, you know, also important. Yes, I'm a urologist. Yes, I harp on people's, you know, prostate cancer screening, etc. But there's other things that can get you as a man. So I think it's important to show up and really, really, really pay attention to the things that you hear from your physician. No one likes to be lectured, but I think it's important to kind of show up, be involved with your health, and get screened.
And it's so interesting that you say no one likes to be lectured, and all you're doing as a doctor is saying this is what you need to do to be healthy.
But I'm not trying to lecture people. I'm trying to be informative, and I think people sometimes want you to be informative.
But I'm gonna argue the comment, because I think you need to lecture sometimes to save someone's life. Because here's the deal: if you have somebody sitting in my chair, they have heart disease, they're obese, they're not exercising, they're not doing anything, that's when a lecture comes involved.
But it's not a lecture. I mean, it's education. It's education. We have to sit down. We have to have a conversation with the patient, because you know what? Like I mentioned, no one likes to be lectured. If they don't like how you're saying it, they're not going to listen to what you say.
Well, then say it to them with kid gloves. Okay, when we come back, the doctor's going to answer your questions, and we're going to share final thoughts on prostate cancer. Do not go away.
Hi, I'm Steve Kamyar. I'm a family practitioner at Glendale Adventist Medical Center, and I'm here to give you a health tip. The health tip is preventive health care. Listen to your grandmother. Get 3 square meals a day, lots of fruits and vegetables, get 8 hours of sleep every night, exercise at least 45 minutes a day. Try to figure out how to take at least 1 day off a week to relax. Do the very simple things, and amongst the simple things, swing by and visit your doctor at least once a year for a simple annual screening exam. The doctor will help you stay healthy, just like when you visit your dentist to keep your teeth healthy, the doctor will help keep the rest of you healthy. And that's my health tip.
Hi, my name's Kevin Roberts. I'm the president and CEO of Glendale Adventist Medical Center. I want to tell you about our website. Our website at glendaleadventist.com has health tips. It has places for classes and education for you and your family. It has a way to find doctors. It has a way for you to learn about the different services that we provide at Glendale Adventist for the whole person. We cover the whole range, and we are here for you.
Thank you for not going away. We are finishing our episode on prostate cancer and men's health. However, a few of our fans posted on our Facebook page, GAMC HEALTHline, some questions addressed to our doctor. Joining us tonight has been Dr. Kamyar Ebrahimi from Glendale Adventist Medical Center. So, doctor, Maria Circle wants to know, how safe is OTC testosterone?
You know, testosterone over the counter is kind of buyer beware. You know,
yay, nay, or just...
I think it should be monitored under doctor's supervision, and I would not do it over the counter.
Okay, Jennifer O'Gorman asked these two questions, and she said, are these dumb questions? And I replied and said, there is no dumb question. Is chili bad for you, and what about yogurt?
Chili is good because it's an antioxidant. Not everyone can have chili, obviously, for gastrointestinal reasons. But I think in moderation is a very good antioxidant. And yogurt is also very good, but if you overdo it, it has a lot of fat. So, you know, a couple times a day is probably reasonable, a couple ounces a day.
What is the main reason for men and insomnia?
Stress, obesity, and their diet.
Stress, obesity, and their diet. They wanted to be anonymous. Is getting an STD as easy as it is for a man as it is for a woman?
My answer is yes, because I don't want guys to be thinking, well, doctor said I'm not going to get an STD. I think you need to be safe 100% of the time. Which
means have a conversation. Because bottom line is, I'm going to say this, and I hope and I know you're going to support me. If you end up having intimate relations with somebody, you're basically sleeping with everybody they've slept with.
Exactly.
So have a conversation that will save your life. Doctor, is psoriasis hereditary?
Yes. I mean, there's a hereditary component, but there's other factors that we still probably don't understand.
Is it linked to one's diet?
It can be exacerbated by someone's diet, but not. It can't be. I don't think it's related to someone's diet being the cause of it.
And final question, in regards to this whole prostate cancer task force not getting screened, what are your final thoughts? How are we with it?
You know, I probably answered the question initially emotionally because it's such an important thing to me.
Sure.
But I think it's important to recognize that most urologists, if not all urologists, vehemently disagree with the recommendation of the task force and still recommend prostate cancer screening every year for anyone who's over the age of 45 if they have a life expectancy of more than 10 years. And if anyone walks away here with any message, that's what it should be. That's what I think is the important thing to get out.
Fantastic. Doctor, how can people find you?
You know, Google me. My website is starurology.com, and, you know, friends and family recommendations.
And of course, we can find you at Glendale Adventist Medical Center.
Of course, absolutely.
It was an absolute pleasure. Thank you, doctor, for doing all that you do.
Thanks, Greg.
Thank you for joining us tonight. So, bottom line is, you have to take care of your body. And that means go to the doctor, pay attention to everything that's going on. If something seems a little bit off, pick up the phone, call your doctor, and say, hey, I need to see you. Because in the best case scenario, they'll send you on your way with a clean bill of health. From all of us here at HEALTHline, have a great night. And remember, the most important conversation you're going to have is about your health. So have one right now. We'll see you next time.